Hi, my name is Danielle Martin. I'm proud to be a family doctor, but I'm also a mom, a daughter, a sister, a spouse, and the Vice President of Medical Affairs and Health System Solutions at Women's College Hospital. And I'm here today to talk to you about something that I feel very strongly about, which is the pursuit of equity in healthcare through the power of innovation. At Women's College Hospital, we believe that every woman, no matter where she lives, the color of her skin, the language she speaks, her income, her job, every woman deserves timely access to the very best health care that we can offer. And that is the fundamental core value and principle that drives our work across our organization, and also specifically in the Peter Gilligan Center for Women's Cancers. Now, behind me, you see a photo of our beautiful new Women's College Hospital, today's version of Women's College Hospital, which we cut the ribbon to just a couple of years ago in 2015, more than 100 years after Dr. Emily Stowe fought successfully to start the very first place in Canada where women could practice medicine and train to be physicians. So that fight for the inclusion of women's voices in healthcare is in our DNA, and it has now been extended to advocacy for inclusion and equity across the whole range of the healthcare system. So if you come to see us, and I hope you'll come but just for a tour, you will find that our hospital looks very different from other hospital organizations. As you've heard, we don't have any beds. As Ed Clark puts it, we're the hospital without the hotel. You can't have a sleepover. And we don't have an emergency department. And we are able to do the work that we do with a maximum length of stay of 18 hours or less by thinking differently about what it is that healthcare is all about in this day and age. We're working to be the hospital designed to keep all of you out of hospital, as you've just heard, and to be the place where, in the face of an aging population, we're creating new models of care that bring care closer to home to allow people to receive health care in what we call their natural habitat, their community. Now, I want to take a step back and ask the question, why does it matter that we do things differently in the care of women's cancers? Why is this an important journey to be on? And the answer is simply that Canada is a very big country. And while, of course, we are all proud of the achievements of our universal healthcare system, I think we all also know that there are big gaps in our outcomes. And that a person who's diagnosed with cancer here in downtown Toronto today is likely to have a very different experience and possibly even a different outcome from a person who receives that diagnosis who lives in rural northern Saskatchewan. So we do not have total equity in this country, and it's not because we have an absence of innovation. As former federal health minister Monique Bégin put it, Canada is a nation of pilot projects. We are very good at innovating, in fact, and very good at perfecting a terrific way of delivering healthcare services in one little community or for one body part in one area. But what we haven't perfected in the Canadian healthcare system is the capacity to spread and scale those innovations so that they become available to everyone who needs them, and not just those people who are lucky enough to happen to get their health care inside the four walls of our hospital. That is then the challenge, not an innovation challenge, but a failure to spread and scale those innovations that needs to be addressed in all kinds of areas of healthcare, but notably in cancer and in women's cancers. And in case you wonder whether this is actually relevant or important in real terms, those kinds of inconsistencies and fragmentation that we see, unfortunately, in the healthcare system translate into direct mortality rate differences. The odds that a Canadian will die of cancer depends in part on his or her postal code. And I think we should all agree that that doesn't need to be the case. That fragmentation and inconsistency needs to be overcome, and we are working on that at our own organization. It's that desire then to heal not just the patient, but to heal the healthcare system that drove the founding of the Women's College Hospital Institute for Health System Solutions and Virtual Care, or as we call it, WEAVE, back in 2013. This is a remarkable team of researchers and innovators, clinicians and quality improvement experts, of anthropologists and design thinkers who are engaged every day in this question of how can we develop and implement and rigorously evaluate new ways of delivering healthcare, whether it's same-day surgery, whether it's offering universal genetic screening for breast cancer, whether it's a new way of helping people who are living with diabetes. How can we evaluate those new models of care in order to ascertain whether or not they are worthy of spread and scale? And then when we find the ones that work, how can we partner with others to scale them up in order to reduce those variations in care and increase the chances of an equitable outcome across the system? And that is the cycle that we're now applying to women's cancers through the Peter Gilligan Center for Women's Cancers. So we're thinking differently, yes, about research, about the way that we deliver care, about education, but we are also partnering with the Canadian Cancer Society, a critical partner in this journey, to work on that spread and scale set of initiatives. What does that mean in real terms? It means that a woman with the family history that you heard Dr. Heisey describe in Joan should be offered the same options no matter where she lives. It means that if it's an effective and efficient way to deliver care for a woman with thyroid surgery, to do that care in a single day, that should be an option available to every woman, not just those who live in downtown Toronto. And through this partnership, we will spread and scale the solutions that are found to be the most important. Of course, there's no one simple solution to the problem of an inequitable healthcare system and indeed an inequitable society. And I think we would all agree and understand that even the very best healthcare system in the world can't overcome inequities that are caused by women's jobs, by their income, by lack of access to nutritious food or safe housing or childcare for that matter. And so there are all kinds of things that even an amazing Center for Women's Cancers can't fix. And that's why we see and have always seen part of our role, not just as a hospital, but as an institution to try to push the boundaries in the areas of those social determinants of health, to try to ensure that every woman really does have the same shot at a healthy life. That's the philosophy that drives everything we do in our organization. It's the philosophy that drives the Peter Gilligan Center for Women's Cancers, and we are so grateful to have your support because we couldn't do it without you. Thank you.